Causes of divorces. Sexual unhappiness is one of the main causes.
That's the biggest problem with our day-to-day societies.
Premature ejaculation contributed to infertility.
Nowadays, we know that male factor it contributes to 40% of the infertility cases.
And what would be the success rate for treatment of erectile?
Almost 85 to 90% the treatment rate getting cured.
Men are willing to service their bikes, cars and gadgets on time, but when it comes to their own health, most men wait until the pain becomes unbearable. Whether it's difficulty passing urine, kidney stones, infertility, sexual health, concerns or prostate issue. Many men simply ignore the signs, and by the time they seek help, a small problem has often become a major one. Welcome to Brindavan Med Talks. I am Dr. Gururaj, intensivist at Brindavan Hospital, Mysore, and today joining me is Dr. Suhas T. Shetty, urologist and andrologist at Brindavan Hospital. Welcome, Dr. Suhas.
Hello, sir.
Suhas, first question as I ask everyone, okay, what made you choose urology as a super specialty?
So, to be frank, the urology is one which gives the patient symptom relief, and we have that patient satisfaction. They present with kidney stones, pain, or some urinary issues and all. After treating them, they have that satisfaction, and we will get that happiness of treating patient. While I was doing my surgery itself, I was very much aspirant for this branch, and that made me choose this profession.
That's really nice. So as I'll come straight to a point. How has the present day lifestyle influenced youngsters and adults?
Nowadays, people we often see with the busy lifestyle, they tend to delay in approaching the doctors.
Okay.
Point number one, because of their sedentary lifestyle, like their habits, smoking, alcohol, and sitting for long hours with their busy schedule, they often tend to get more of these urological diseases, we can say, like stones or sexual issues, infertility kind of thing. So these are definitely with the food habits also. People are more tend to get these diseases, urological conditions.
Okay.
So it is impacting their lifestyle, and they should make some alternative for that. They should see to that their lifestyle should be changed.
When we go through the causes of divorces, okay, sexual unhappiness is one of the main cause. Okay, and youngsters are dealing with it, and youngsters are shy to come to a doctor regarding the sexual issues. How do you think the present day scenario is about the youngsters?
First thing is mainly because of the embarrassment. That is, what if I approach the doctor, what he will think? That itself a delay in approaching doctor. So from there the problem starts. So mainly the thing is, the relation should be good, and there should not be any anxiety issues that okay, the problem is with me, the problem is with the female partner. So nowadays we know that male factor it contributes to 40% of the infertility cases, not only the female issues. Okay, so the world, the society, it shows as if the female counterpart is the main problem. That's not the thing. Even the male partners also, they have this issue. 40% they can contribute.
Okay.
They can have this decreased sperm count. They can have with low testosterone symptoms also,
Okay.
loss of libido, and they can have this premature ejaculation as well as erectile dysfunction. These are all conditions which contribute to these conditions.
Okay.
They often tend to delay, like suppose the couples, they come to us with the infertility issues. These are the basic conditions which should be treatable first. So if they approach the doctor early, the urologist early, without any hesitancy, definitely the causes can be treatable. Okay, at the early stage. If they delay in approaching, definitely that can lead to all these consequences of relationship issues, as well as anxiety, as well as blaming each other, and ultimately leading to all these divorces or other scenarios.
How has premature ejaculation contributed to infertility?
Premature ejaculation as such, it doesn't contribute to infertility much, sir, because it's just a husband-wife relationship, like satisfaction kind of thing. more often I see patients who are getting biased with the Google thing as well as the other social media. With that, they get influenced and they approach to us, and that is how we educate them. This is not the thing. Premature ejaculation, certain duration itself, not like as you think what it is.
Yeah.
That is the thing.
Okay, but how will an youngster identify what exactly is premature ejaculation?
Premature ejaculation is always intravaginal ejaculatory latency time. We call it as. That is the time. Usually, it will be 3 to 6 minutes.
Okay.
It differs from individual to individual.
Okay.
That's the means.
So, erectile dysfunction is one of the common things from youngsters to adults. It's not just an thing related to adults or post 40s. Even youngsters at the age of 20, in their 20s, also get this erectile dysfunction. Can you explain in a layman's term what exactly is erectile dysfunction and how to identify and how they should approach a doctor?
Erectile dysfunction, what the layman presents to us in the clinic, that's what I'm telling, sir. They present with, they doesn't have that sexual desire, they will not have that erection, even with the female counterpart. And we have seen patients who say that they doesn't have this erection with their partners, but they will have the erection with their extramarital affairs. That is how to be, I mean, if I want me to speak frankly, but that depends on the relationship issues. If the husband has got some issue with the partner, it depends on the stress what he is carrying in his day-to-day life schedule. If you have the stress in mind or any relationship issues, or if he is having that anxiety, okay, I am suffering from this erectile dysfunction, definitely these all things contributes to it. Not only that, his habits, whether it can be smoking or his sedentary lifestyle, if he is obese, these all things will contribute.
But when do you call it an erectile dysfunction?
When he is not able to attain the erection, that is erectile dysfunction.
Okay.
Erectile dysfunction is when he is not able to attain the erections. That is erectile dysfunction. The problem is with the patient itself because of all these issues, or some pathology is there, that's organic cause. So these are the two conditions we will first try to differentiate with the patients.
How has lifestyle been contributing to this erectile dysfunction?
Saying about the causes for erectile dysfunction is day-to-day life. One is sedentary lifestyle and his habits. It can be with smoking, alcohol, any conditions associated with him, like he can be diabetes, hypertension. We call it as metabolic syndrome also. If he's obese, these are all that can contribute.
Will this patient subjected to a psychiatric or psychologist reference, or it can be treated purely by urology?
Not necessarily always we will ask them to go, but at our level, if it is treated, definitely he will be able to get it cured. Not that he will not be subjected.
And what would be the success rate for treatment of erectile dysfunction?
Definitely, we have seen patients with almost 85 to 90%. They will be having that the treatment rate getting cured.
Okay. Whether this terminology called impotency and erectile dysfunction same, or it is different?
Impotent is different, sir. Erectile dysfunction is one where he will not be able to attain erection, but his sperm count, everything will be normal once he attains erection. Whereas impotence is nothing but with the analysis, he will not be having that sperm count. He will not be able to have a father, a child. He will not be able to complete a family. That's where impotence term will come.
So if I have to summarize, erectile dysfunction is not impotency. So the youngster should not consider them as impotent just because they have erectile dysfunction. And almost 85 to 90% it's curable.
Definitely.
That's really nice.
And more oftenly, saying a few words about the patient presenting to us, they often delay with embarrassment, point number one. Okay. They think that they are like stigmatized, second thing. Okay. Third thing is because of the fear of getting diagnosed with some issue. These are the few conditions, few things where we see patient, they delay in approaching a doctor. Okay. That's the thing. They should overcome this. Early presentation to the doctor will help in diagnosing the early conditions which can be treatable.
See, off late the Instagram is loaded with reels of Kegel exercises. Okay, apart from the medication, do these exercises help in erectile dysfunction?
Definitely is. That is the Kegel exercises for mainly for this premature ejaculation and all, it helps a lot.
Okay.
That's where we tend to, we treat patients with, first is with the behavioral therapy. Second thing, then we subject them to medications. We try to educate them. Not only just they come to us with, okay sir, I'm having this premature ejaculation, erectile dysfunction, all these things. But mainly for premature ejaculation, this Kegels exercise and few methods where they can have the treatment get cured by themselves.
Can you share any of your clinical experiences where the family has sorted out this and lived happily?
Couple presented to us, they came getting conceived for the second child. We doesn't call it as primary infertility. They had the first child. For second child, they had 5 years of post-marriage life. After which, both of them were sitting, and the husband was hesitant to share his what problem he was going through. Whereas the wife, she started opening up, saying that she doesn't have this happiness, or their sexual relationship is not that good. Send the wife out, as well as I was forced to educate the husband, and I asked him what all conditions he was going through, and that's where he opened up, saying that the premature ejaculation was the main thing. Because of that issue, they were having that relationship issues.
Okay.
So then I educated him and I started him on medications, after which he got treated himself, and the couple conceived also, that live happily. And it's not like premature ejaculation, it will be for long time, or patients, they tend to ask us, should I take this medicine for long time or not? It's not necessarily. If they take for certain duration, and then if they follow whatever our behavioral therapy, whatever, definitely that will help to prolong this premature ejaculation.
Speaking only about youngsters, let's go to adult and old age. So what is the maximum age where the patient has approached you for this problem?
There is no the age limit for males especially, sir. I have many patients who hesitate to come with these symptoms approaching to me. They present with some urinary issues. At the end of my examination, they tell to me that they are having this problem also. So there is no age limit. I have treated 65, 70 years, and they have come back to me with very much satisfaction with the medications, what we have said. There is no age limit, especially for males. Males, they present to us with any age for this erectile dysfunction or premature ejaculation. Mainly at the older age too, we see more often for this erectile dysfunctions are common. I have a patient who got treated by me, and he has personally thanked me recently also. He is 73 years now.
Very nice.
And he is very much happy with with the medications, and he's doing good.
Okay. And self-medication.
That's the biggest problem with our day-to-day society, sir. That is where they often delay with the presentation to the doctor. They tend to treat by themselves. They think that this can be cured by themselves, or some other person, some other patient he had similar issues. He got treated by this doctor with these medications, so he tends to take the same medication, and he will be having some other issue which will be missed or getting delayed in the treatment. That's the one thing which I advise to the society not to do. Self-medication is not at all advisable.
Roadside, I have seen many people regarding the herbal medication for erectile dysfunction. Do they really work, or what do you want to say about those?
So I don't want to comment much about it, sir. But
Okay.
our English medicine definitely it helps.
Okay.
Help in some part, but I'm very confident about our treatment.
Okay. Then what other infertility issues as a urologist do you people treat?
In this male infertility, patients will be having decreased sperm count. Sperms will be non-motile. All these things we'll be treating by giving supplements initially. And we just see, there are parameters in the semen analysis where we consider all the parameters, and based on the parameters, if there is decrease in sperm count, definitely yes, we will give supplements, and we'll try after giving supplements for about a month or 2 months, and then we will repeat the analysis. And suppose we see most of the patients getting treated by this alone, and we ask them to alter their lifestyle to cut down their habits. I have seen in my own circle that once he has cut down his habits, he has got from 0 counts to
It's amazing.
normalcy. Yeah, that's the one best example which I give for all my patients who are present with this infertility issue. It's not mandatorily that it will not be corrected, or it should be treated with surgery alone, or with supplements alone. Patient's lifestyle itself, it matters a lot.
Okay.
Then we will subject them to this intrauterine insemination or IVF, these things. That will be at the last resort. Not like nowadays I have seen patients particularly coming to us with 6 months of like post-marriage life. They present to us not getting conceived. They have a stress. Okay, what if I doesn't get conceived? And they themselves, they tend to approach us. Can I go for IVF? I educate them personally. They should not be hurry for getting conceived or anything. Because of the family, their paternal and maternal side, pressure, they tend to approach us. That is the main thing. And moreover, the stress what they carry, even the female counterpart also there, and the male side, that matters a lot.
Okay. Apart from the anatomical factors, what are the environmental factors that has been contributing to male impotence?
Patients, people tend to sit for long hours with their laptops, everything on issue, and prolonged heat exposure. That is also one factor which contributes, to this sperm count variation. So prolonged sitting when laptops on their prolonged heat exposure, all this will contribute.
Okay. And is there any comment on the undergarments? What they wear? Does it contribute to the?
Not necessarily.
It's not necessarily. So there are so many things, information regarding those.
Yeah, there are some misconceptions are there. That should be corrected, sir.
That was a great information regarding erectile dysfunction and impotency. Okay, let's move on to our next thing. Why are the incidence of kidney stones raising among public?
Nowadays, kidney stones, more commonly it's because of less drinking of the water, less consumption of fluids, I can say. Okay, they are very much dehydrated, chronic dehydration. They tend to drink only 2 to 3 glasses of water a day. After breakfast, after lunch, after dinner. With the busy lifestyle, people, most of us, we tend to forget that we should keep hydrated like ourselves much. At least 2 to 3 liters of water is much. Drinking water is necessary, one thing. Second thing is, we should try to avoid as much as junk food. This processed food, which are rich in salt, we should avoid. And more consumption of protein, especially with the youngsters. Go for gym and take these protein supplements heavily. So taking excess of protein is also not advisable.
Okay.
These are the common things.
So there is no symptoms, but you are diagnosing when you subject them for a radiological investigation. So the incidence to pick up kidney stones has become more as well.
Yeah, even because they tend to get initiated for some other reason, and the incidental finding will be with the kidney stones, because not all people will present with the kidney stones. With the symptoms.
So what exactly will be their presentation? Like when? Because many people with abdominal pain, they tend to take home remedies without consulting the doctors. What are the symptoms of kidney stones? Like they need to come on an emergency.
First thing is, when we see patients presenting to emergency with persistent back pain or flank pain, the flank pain is the first thing. They will be having this vomiting, and they will be having burning sensation or blood in urine, or difficulty in passing urine, or they can't in delaying the presentation, they can present with fever also. Okay. These are the few symptoms which we should never miss. And we have seen patients with asymptomatic presentation also. Even they will be having kidney stones, but they will not be having pain. So it doesn't mean that all kidney stones should be presented with the pain. They will be having some burning sensation while passing urine. That patient also can present with the stones, and we have seen when subjecting to scanning ultrasound for this radiological imaging, he will be having the stone. So we should be very particular and very keen about patient symptoms. By hearing to the patient, definitely yes. He will be telling he will be having some pain in the testes, on tip of the penis. While urinating, he is having the burning sensation. So this definitely yes, that patient will be having stones also. So we should be very careful.
What is the youngest age you have seen having a kidney stone?
We are getting patients with pediatric patients also. They present that.
Pediatric patient.
But yes, pediatric patient, they will be having some metabolic abnormality. So metabolic evaluation is a must. Or some genetic pathology will be there. So 2 years, 5 years, 10 years, 13 years, any age for that matter. There is no as such any particular age group for this. But more commonly we are seeing stones in our 20s to 30s younger age group.
And do you think the public has to undergo every year scanning just to keep a track on whether they're having a...
And it depends on their individual perspective, sir. If they're good in their maintaining the lifestyle, yes, not necessary. If they are very keen in maintaining their health, definitely yes. At least a routine basic blood test is mandatory. Along with this, basic ultrasound imaging can be done. This will help to keep their track, the health track record, so that they can be confident and in living their lifestyle.
So if we have to speak in a language where the public has to understand, how will you proceed once the kidney stones have been diagnosed?
Patient when present to us with complaints, we examine them, then we subject them for investigation. Two modalities will be there. After the basic blood investigation, we subject them to scanning. That can be ultrasound or CT imaging. Difference between these two is, one is cost perspective. CT is quite on higher side, whereas ultrasound is bit lower side, and the radiation exposure will be there in CT. So that also we need to consider. If pregnant women present to us, we need to do ultrasound itself. But CT gives more correct information. It gives the size of the stone, location of the stone, and number of the stone, and whether it's 2 or 3, whether it is in the ureter, that is from kidney, they will get the connecting tube from kidney to bladder, that we call it as ureter. So there, more commonly patients who are having stones in the ureter, they present with acute pain, that is in the pipe which connects from kidney to bladder. So once we diagnose, we see the blood parameters, that is kidney function test, and whether patient is having fever, any signs of infection is there in the patient. So if these symptoms are there, based on the symptoms, we have seen a 3 mm stone. Ideally, we tend to treat more than 5 to 6 mm stones. Okay. If a 3 mm stone is there which is causing more pain to the patient, definitely then we'll think of, okay, not all people will pass the stone through urine. We say people tend to go with this home remedies, as I said. They tend to treat themselves, and they often delay in approaching doctor. That when they come, they often present to us with infection, fever, and all. So once we diagnose with the stone size location, depending on the size of the stone and symptoms of the patient, we plan our management. We tell to the patient that, okay, this stone is in this location, so this can be treated by medicines alone, and he should drink plenty of fluids. Let him take these tablets. We give some medical line of management where these medicines help to expel the stone out. Okay, and we educate them. Just try to watch whether stone will pass in the urine. That is the thing. If a dog patient is having fever, they have difficulty in micturition and vomiting and all, we admit them. We try to manage conservatively. If the stone sizes are very small, suppose you think like 3 mm, 4 mm, that's how our routine practice goes. If it is more than 6 to 7 mm, we definitely, from our side itself, we tell them that, yeah, this should be treated by surgery. Okay, decreasing the size of the stone can be managed conservatively if the patient doesn't have much symptoms, if his blood parameters are normal. If the patient kidney function test is deraised, patient is having fever, persistent vomiting, in spite of managing medically, definitely for a 3 mm stone, 4 mm stone also, we are forced to do surgery. Because we have seen patients, in their common life, we have seen patients telling to others, like, I have passed 8 mm stone. Not necessarily all patients will have the same this body habitus, because one person ureter lumen will be big and the other person ureter will be very narrow. So if a person with 8 mm stone, if he has passed in urine, not mandatory that the other person should pass 3 m's. So that's how they just have this misconception. Oh, he passed with drinking a lot of water, and more commonly we see drinking beer will help. Definitely no. That will, instead of wasting money with the beer, let them drink plenty of water. That's enough.
Okay. That was my next question, actually. So that is a myth, actually.
That's a myth, sir. Actually, it's not mandatory. They need to drink beer itself. Instead of wasting money, let them drink plenty of water, fruit juices.
In fact, they'll be dehydrating themselves
Dehydrated.
a lot.
Yeah, exactly, sir. Because they often tend to say that, okay, they once they drink beer, they're forced to pass urine. That's how it will pass. Not necessarily. If it drinks liquids, water, juices, fresh juices, that's alone. Nothing.
But is there case reports where the stones have got infected and they end up landing an nephrectomy? Like
Yeah, yes. Yeah, because I got a patient in my clinic, 44-year female. She had just consulted a gynecologist. At that particular time, she had, consulted for some menstrual cycle issues. They got a scan done. She had a 6 mm stone in the ureter, but she didn't have any pain. Her complete kidney was gone, and she underwent nephrectomy also. But the thing is, she will be having some other urinary issues which she would have neglected, like baronial frequent urination. So depending on the stone location as where particularly the stone gets blocked, they are also present with these urinary symptoms which they should not miss. They tend to treat themselves or consult a nearby local, where they get treated for urinary infection. That's how they miss all these things, and they will be.
I would have taken unnecessary NSAIDs.
Definitely, yes. And that's, as you said, NSAIDs. No, they should not. The patients should not make a habit of taking NSAIDs much. That will definitely impact on the kidney. And I should speak about this topic morely. Something called as flush therapy. Flush therapy, they often keep telling to us. They will call and say that they gave flush therapy. There's nothing called as flush therapy. Previously, this was in practice, and now there is even a 4 mm stone. If tube load on this, if it is narrow, doesn't come. We need to go there and we need to take out the stone and come.
Okay.
Now, if you bombard the kidney with more fluids, and if you give this flush therapy, they tend to give Lasix and all, that doesn't help, and it will create a back pressure, and definitely the kidney will get ruptures. There will be collection. These are the common things where, as we see the CT scan, our next question will be, did you get treated anywhere? In the nearby local clinics or anywhere that they can go for local clinics and get this pain managed there, but not with this flush therapy, and it doesn't help, sir.
Okay. So, but when it comes to cardiac patients,
yes, sir.
Okay, where they have a restricted fluid intake, or a chronic kidney disease patient where there are restricted fluid intake. So, what do you advise them? Because for a normal person, what do you expect a normal water intake should be per
At least
day?
2 to 2.5 liters a day, sir.
Okay.
That is the one thing for a normal person. Cardiac, definitely we need to give importance for heart also. They will be forced to take only 1 to 1.5 liters.
Okay.
With that fluid restriction and their food habits, and avoiding more of protein and this processed food and high salt and all, if they avoid, definitely they can manage.
Okay.
Because the both should be balanced equally. That's the thing.
Okay. There are different ways of doing surgery for all these things. So, what are, in a layman's term, what exactly do you do in ureteroscopy and PCNL?
Sir, the thing is, stone size, stone location, both things matter a lot, and especially along with the patient presenting complaints. If the stone is in the ureter, as I said, the tube which connects from kidney to bladder, definitely yes. If the stone size is very small, small means in sense we have stone criteria. So we will be passing our ureteroscope through the external genitalia, through the natural, through the meatus. We'll go inside, we'll go approach the bladder, and we'll go through the tube, that is ureter. We will break the stones either by pneumatic lithotripter or by laser. Once we break the stone and taking all the fragments out, or making it to small powdered pieces, we will place a stent. Ideally, the stent is which connects from kidney to bladder. Okay, it will help in draining the urine, and it will tend to avoid the post-op complications much.
Okay.
So we'll keep that stent for at least 3 to 4 weeks, and we'll educate them that they should come after 1 month to get that stent removed. One thing. Second thing is something called as we do PCNL, percutaneous nephrolithotripsy. That is, by making a small hole on the back side, on the particular side of the stone, either it is right side or left side in the flank region, and then approaching the kidney, and wherever the stone is located, we'll break it and we'll remove it. That is other method. And the next is retrograde intrarenal surgery, we call it as RIRS. That is, through the external genital itself, we'll pass a flexible scope, and in that we'll go inside the kidney, okay, and we'll make all the stones into we'll dust it by laser. We'll make it into small pieces, or we'll just powder it, and then we'll come out by placing a stent. Nowadays, even stuntless also we have started doing. That is taking all the fragments out, doing section. And suppose if the tube is ureter is very narrow, then we will be placing a stent. So placing a stent is also necessary. And if the stone is very big, we have doing laparoscopic surgeries also. That is, we'll just cut open the ureter if it is 2.5 centimeter in the ureter and all. We'll do this ureteral lithotomy also. Instead of breaking it for long duration from like lower down, we'll just cut open the tube and we'll take out the stone, and then we'll be suturing it. Laparoscopic surgeries also is done. And there is something called as extracorporeal shockwave lithotripsy, ESWL, which was there before, which is even there now, and which will be there in future also. It's, for kidney stones inside the, for stones inside the kidney, not in the ureter. Stones inside the kidney, if it is depending on the size, not too small stones or not too big stones also will be doing it. We will be giving the shockwave treatment, and stones will be powdered, and that powder will be passing through the urine. These are the 4 modalities, common modalities. One is through ureteroscopy, one is through puncturing in the flank region, and one more is retrograde intrarenal surgery, RIRS, and lastly ESWL. And along with this, laparoscopic surgeries also. These are the common modalities.
That was an extensive knowledge about kidney stones. Coming down to the prostate, what is the youngest age where you have diagnosed hyperplasia?
Prostate, the enlargement as such, it will present in quite old age itself. After like 45 we can say. 45 to 50 ideally. But the younger patients, they will be having this prostatic infection, prostatitis, or they present to us with prostatic abscess. In mainly with the diabetic patients. Prostatic abscess and all, it will be more common. So prostate enlargement after 45, we can say, men should be, they will be having some basic knowledge about this prostate symptoms. What are the basic symptoms will be there? That is, they will be having this increase in frequency and thin stream of urine. They will be not able to control the urine. As soon as they approach to the restroom or whatever, they will be tend to pass urine there. So they will be having that incontinence, urgency amounting to incontinence, we say. And so suppose if they delay the presentation, they can go for like retention. All of a sudden they will go for sudden retention. That they should not let that condition to go till that particular point. They need to present to the doctor with the initial stages itself.
You spoke about incontinence. Is incontinence common in adults?
Yes, it can be there. But we should treat the cause.
Then when it comes to prostate surgery, can you explain in layman term what exactly are you doing?
As such, prostate in males, that's how I educate our patients. I'll just draw a diagram with the bladder and then the penis, as well as I just show them the prostate, how it will be. In all males, prostate will be there. Once it gets enlarged, 2 things we should see: whether the enlargement is normal or a normal growth or an abnormal growth. How do we differentiate normal growth by doing a per rectal examination? They often feel shy when they are in our clinic and all. We tend to, we ask them to lay down and we need to examine. They think that what I am doing with this examination in the rectum side. That's where I educate them. See, I need to palpate the prostate, whether it is any abnormal growth is there, so that the diagnosis completely and the treatment completely differs. If it is normal, that is benign enlargement, different line of management is there. If it is a cancerous malignant growth, different management is there. So once the prostate is enlarged, once we feel the prostate is enlarged, we subject them for prostate specific antigen examination, serum PSA examination. That is a blood test ideally, where we see the value and we'll get a rough idea about whether it is benign or malignant, normal growth or abnormal growth. And along with that, our subjective, our examination findings, 2 things. And we'll get a basic scan done. Once the basic scan is done, we will get the size of the prostate.
Okay.
Exactly, like normal prostate is up to 15 to 18 grams. They will be having like 35, 40, 50, 100, 150 grams, 180, 200. We have seen all sorts of patients. A 100 gram prostate patients also, they will be having like normal voiding habits. But whereas a 40 gram prostate, they will be having all sorts of this voiding difficulties.
Okay.
So depending on the symptoms, but it's not, we should not leave this 100 gram prostate patient to just neglect the things like that, because that can lead to all other abnormalities like urinary retention, which can lead to kidney damage. So the block, what is there in the normal flow of urine tract, it should be treated. How means, one is for a small prostate gland enlargement, we subject them with the medication. So many patients will be happy with the medications. Or if the patient present to us with the recurrent symptoms with enlarged gland, or patients who are having more gland size, they will be subjected for surgery. We will be passing a scope through the meatus, that is external genitalia, and whatever the extra growth of the prostate is there, we will be resecting. Once we do this resection, we will subject those tips also for the examination, histopathological examination, just to make sure whether that is normal or abnormal, benign or cancerous, malignant. We will be coming to a conclusion. And once the block is released, definitely yes, patient will be having that happiness with their voiding difficulties, and then whenever they come to follow up, that's so we will come to.
Okay.
We will come to know about their happiness or satisfaction, what they are having.
Okay. Another thing, Dr. Saas, what exactly is phimosis and how is it contributing to the urinary tract infection? And my third addition of question is, what set of patients should go for circumcision?
Normally physiological phimosis in pediatric patients and all, it will be like correctable. With the 1 month of application of this steroids cream and all, definitely yes, they will be. First of all, let me tell you what is phimosis. The inability to retract the preputial skin means patients will not be able to retract their foreskin behind. That is the condition what we call as phimosis. But most of the patients, what I have noticed is, they tend to say that, okay, I'm very much comfortable with this. I'm having this since so many years.
Okay.
Yeah, I don't know. Maybe that can affect them with their sexual intercourse also.
Okay.
That can cause repeated infection. So definitely phimosis in adults should be treated. Okay, because that can contribute to repeated. There is something called as smegma accumulation. This patient will not be able to pass urine completely. They will be having this urinary retention can be there. Okay, and this can contribute to repeated urinary tract infection also. Pediatrics, we can wait till certain age, like up to 3 to 5 years, and after applying the local creams like steroids and all, these are correctable, and we have done it. Okay, that's how treatment plan goes. But whereas after certain age, in spite of applying all these things, if it is not definitely yes, they should go for this circumcision surgery. That is, we'll cut the foreskin and then we'll suture.
The incidence of cancer is rising. So is the incidence of kidney cancer, bladder cancer, or penile cancers, and all those things. What do you have to say for the public regarding the cancers in urology?
Definitely. See, in our urological side, patients tend to present with the initial symptoms like they will be having they will be passing blood in urine. They tend to think that, okay, once I have passed, then this has got nothing to do with it. That will be the first sign. Okay. So any symptom for that matter, if our kidney cancer or bladder cancer or prostate cancer, they will be presenting with the minimal symptoms like this blood in urine. More commonly, we see this blood in urine hematuria. So they should present to us as early as possible, first thing. And they should be very much particular about their lifestyle changes. See, for example, kidney cancer, hypertension, obesity, smoking, All these things matters a lot. These are the basic causes for all these things. So, and very rarely we see patients presenting with the incidentally. They will try. I had a patient very recently, 1 week back, who had a stone in the ureter, that is the tube, kidney to bladder tube. But he was found to have kidney malignancy.
Okay.
I was telling the same for him. See, it's your good that you had stone, and because of the pain you came here, you are diagnosed, and it doesn't let him to present for the delay in the approach.
Okay. What do you want to say to the public about screening of urological cancers?
With the minimal symptoms, approach to your doctor, whoever is there, like urologist, and get yourself screened with a basic blood test. Basic blood test panel will be there, and get a minimal radiological imaging also done, so that everything is fine. So if everything is good, then I can at least once in a year they can subject themselves for this health checkup. After 45 years, along with the routine health checkup, there are also, especially for males, this serum PSA, prostate and all, it should be screened. Because we have seen prostate cancer and all, they run in families.
Okay.
So they often tend to miss. So whenever if like old age person presented to us, we educate their sons also.
Okay.
That you should be careful, and you should get yourself screened from this particular age, early ones.
Okay. This is an extensive discussion on urology and urological procedure as well. So can you say some of the myths what you face in urology and some of the facts what you have to tell to the public?
As you asked me, sir, saying about the myths, first thing I would like to say, kidney stone, will it affect only any particular age group? It can affect even the younger age group as well as older age group. It doesn't only affect older age group people. So there is no irrespective of age. And drinking beer, will it help in passing kidney stones? No, instead of wasting money, you drink more of water. Definitely that will help. And infertility, the people have that mindset that it is mainly because of this female counterpart. Female, no, it can be male problem also. 40 to 50% male infertility is also cause for this couple, this issue. And the erectile dysfunction, will it be more common only in older age group? No, it can affect this younger age group also.
This was an extensive discussion on urology, Dr. Suhas.
Thanks.
We really thank you for this enormous knowledge, and I'm sure the public will be completely benefited with this.
Sure, sir.
Thank you so much for coming for this show.
Thank you for giving me this opportunity. Thanks.
Men often stay silent about health problems, but silence doesn't solve diseases. Today's conversation reminds us that early diagnosis, awareness, and timely treatment can prevent serious complications. Thank you, Dr. Suhas, for sharing such insights. And to everyone watching, don't ignore symptoms, don't delay checkups, and don't be embarrassed to seek help. Because taking care of your health isn't weakness, it's a responsibility.